It's my pleasure to introduce Moshe Rosenwein. Moshe is a director at Bayer, where he is going to be talking about the optimization of portfolio resources. I'm sorry, promotion resources. Moshe and I first met at Bell Labs a long time ago, and we worked together there for quite a while. But more importantly, Moshe does have Philadelphia route. He receives his PhD in decision sciences from the University of Pennsylvania. I'm kind of excited to hear about marketing mix and optimization of promotion resources. So without further ado, I will turn it. I'm sorry. I will turn it over to Moshe.
Thank you, Mark, and thank you everybody for joining. I know it's kind of the end of a workday, and sometimes things come up at the end of the workday and so forth. So thank you for everyone for taking time to join in the webinar today. So let me bring up my screen, which just make sure I can do this here. So this is a talk that I actually gave at the Informs meeting in Houston. It's the business analytics meeting, which is really geared towards practitioners of management science. And my chair at the session actually and Mark were colleagues a little bit more recently. And so we got to talking, and you know how networking goes, and that's part of what Informs is all about. So it was great to reconnect. And again, it's really a pleasure and really an honor to present to the group this afternoon. So I've been with Bayer for 5 years, and actually my 5th year anniversary was just this past Saturday. And I've been actually doing marketing mix for 5 years, and I never expected to do it for 5 years when I first joined. I'm not really sure what I thought would evolve, but one thing that's been very interesting to me is that I've been fortunate that my team and we've been able to not only do marketing mix for individual brands at Bayer, and I'll describe that, but we've been able to also build a portfolio optimization tool, actually a nonlinear programming tool, which is kind of near and dear to my educational background. And we're able to actually run scenarios and optimizations for the pharmaceutical portfolio at Bayer to try to optimize promotion resources. So it's been kind of cool, and I've been really, frankly, proud of the work that we've been able to advance at Bayer. So I'm sharing the full screen, by the way, and just to let everybody know, I apologize, but I can't see the chat from the full screen. And I can't see anybody who may have raised their hand. So the guidance was to try to speak for about 45 minutes and then open it up for questions. So I'll try to adhere to that schedule. Before I start the formal presentation or the informal presentation, we are sort of an informal group, I've been asked to just go over these kind of points that you're seeing right here. And first is that the opinions that may be expressed either in the slides or during the audio portion of the presentation are my opinions and not necessarily those of Bayer. In addition, I do want to stress that a primary objective of Bayer Health, Marketing, and Sales Operations, really the whole commercial operations team, is to increase awareness among healthcare providers and patients of medications that may be intended to benefit their health outcomes. So now let's get into marketing mix, as Mark was introducing. And the kinds of business questions that we're trying to address have to do with marketing and sales strategic decisions that are being faced, in this case by a pharmaceutical firm, although as I discovered at the Houston Informs meeting, quite a number of other industries have similar types of marketing mix questions. And obviously, if we're working with a particular brand at Bayer, we spend a lot of money on promotions. We spend tens of millions of dollars, and if there's a television campaign involved, it's probably over $100 million when you include the sales force, the television, the digital marketing. And frankly, the business wants to get a report card. Was the promotion budget profitable or not? And if so, what were the strong points? Where are there areas for improvement? And likewise, from a portfolio perspective, where are there opportunities to increase budget? Where are there opportunities to decrease? Do we have to shift money between brands and so forth? So there are a lot of strategic questions that a pharmaceutical company will have with regard to promotion spend. And marketing mix, I always like to tell my business partners, there's sort of two primary business purposes. One is the retrospective, the look back, the report card. You spent $100 million. What did you get from it? Did you get $200 million? Did you get $50 million? I always enjoy the prospective more. It's really sort of looking forward, which is, okay, what do I do next year? The brands probably kind of in the early fall timeframe, they go through a whole planning process where they lay out their budgets or their proposed budgets for next year as far as promotion is concerned. And they go into itemizing, you know, we want to spend this much on television, we want to spend this much on peer-to-peer and so forth. And what my team and I try to do is we try to provide the brands with return on investment as well as marginal return on investment prior to this brand planning process, so that they can get a perspective, at least from a marketing mix perspective, at least from a management science perspective, how to optimize their budgets going forward. And by optimizing their budgets, it's typically growing incremental sales. So let me just again sort of get everybody a little bit introduced to pharmaceutical marketing and sales. And the kinds of promotions that we have sort of two flavors. We have personal promotion, where, for example, a sales rep goes into a doctor's office. We call that a detail. There are samples that we give out. There's peer-to-peer programs, such as speaker programs, or also so-called roundtables, where we might hire a doctor to speak to his or her peers about the benefit of a particular Bayer product. I should point out, and this is coming from me as well as I'm sure the legal department, we never would measure the return on investment for a speaker that we pay. We would only measure the return on investment for those doctors that attend the program, that are our guests at that program. So let me just be very clear about that. But then, of course, we also have the non-personal promotion, and as you might expect, that gets a lot of attention these days. Digital marketing is a big thing. Pharma tends to be a little bit behind the consumer packaged goods industry, but we do catch up, albeit maybe a little bit slowly, but we do catch up. And we certainly have a lot of digital promotion going on. Obviously, during the pandemic shutdown, our sales representatives were not able to go into doctors' offices. And I think just in general, it sort of changed the whole paradigm of how we conduct business. Some of our brands, not all of our brands, because many of our brands tend to be very specialized brands, sort of rare disease brands. But some of the larger brands do have television advertising as well. And obviously, there's a lot of attention given to those tactics. And then we have response, right? And so this is kind of a classic statistics paradigm where you have sort of the independent variable being promotion activity and the dependent variable being sales response. And in pharmaceutical world, sales response could be in the form of prescriptions. It could be in the form of new patients that are being put on a prescription. It could be in the form of treatment days. Typically, we will work with total sales and new patients. Those seem to be the two that are of most interest. And then finally, we have a kind of a suite of tools, a simulator, an optimizer. In fact, right before this call, I just got an email from a member of one of our brand teams. She wanted me to simulate a new direct-to-consumer budget for her brand for 2022. She's thinking about making some changes, or she may be forced to make some changes in the second half of the year, and she wants to understand what is the potential sales impact if she were to modify her promotion budget. So we have tools to both simulate, meaning that if a brand team wants to say, look, here's our proposal, can you evaluate it for us? We'll be glad to do it. And likewise, if a brand team says, we don't even have a proposal, or we'd like to hear your proposal, what are the optimal levels of spend that you would recommend? And we can do that as well. So this slide's a little bit busy, but I think it captures some of the key concepts in marketing mix. So a lot of boxes here. Obviously, you see all of the inputs. And one of the things that I like about marketing mix is that you've got all of the programs being evaluated simultaneously. I've been in other situations where I've seen analysis around a specific program. And the difficulty with that, or the challenge to that, is that you're not controlling for other promotions that might be touching your customers at the same time. So in marketing mix, we gather the data for all of the promotions simultaneously, and that obviously is going to make a difference here. There are a couple of curves on the bottom that I'd like to call attention to. One is the response function. Obviously, it's a concave nonlinear curve, and it really captures the fact that you have kind of this decreasing returns to scale, meaning that if I start a promotion at the beginning, I get this really big impact, and it looks like the best thing since sliced bread, and I keep doing more and more of the promotion. Eventually, it's going to flatten out. The response curve is going to flatten out. There's going to be decreasing returns to scale. Now, the other curve is the marginal ROI curve. And let me go into a little bit of detail on this, because I think a lot of what comes next is all based on the marginal ROI. So when we speak about ROI, or average ROI, I could, for example, tell you, we spend $100 and we get back $200. And I'll say, that's great. You have a return of 2 to 1. That's terrific. So your average return on investment is 2 to 1. Now, let's say I gave you another dollar. So now instead of having $100, you have $101. I'm going to tell you, based on the fact that returns are decreasing returns to scale, or sales are decreasing returns to scale, that you're not going to get $202 from 101. So if 100 netted 200, that $101 might only give you back $1.50 in incremental sales, or $1.25, or maybe even 80 cents. I've seen that, right? I've seen situations where the average ROI is very positive, and yet the marginal ROI might be negative, meaning, I spend $1, I get back 80 cents. Now, you know how it is in business. There's no hard and fast rule, but it's from an optimization perspective and from an analytics perspective, there's something to be said about the so-called sweet spot. And the sweet spot here is where the marginal revenue and the marginal cost are equal, right? So if I give you $1 and I get back $1, that's the point at which I want to say, okay, stop giving me more budget, because at this point, I'm going to start losing money for the corporation. And that's not a good thing in general. I say in general because I've been in situations with brands where they have argued, and somewhat persuasively, believe it or not, that going ahead with a negative marginal ROI can be acceptable. And it can be, especially for a launch product, which is not expected to be profitable in the early years. But putting that aside for a moment, the marginal ROI in general is a signal for me, and it's also a signal, I believe, for my business partners as to whether we have right-sized the spend for a particular promotion. Again, if the marginal ROI is positive, that means that last dollar, say, is bringing in $1.25, then you know what? I not only have to give you $1, I have to give you another dollar, or maybe a third dollar, fourth dollar. I have to give you enough dollars so that we get to the point where, again, the marginal revenue equals the marginal cost. Likewise, if the marginal ROI turns out to be negative, maybe we have too much of a good thing. And even though the average ROI could be positive, maybe we need to be thinking about reducing the level of spend on a particular tactic. So MROI, or marginal ROI, is really a very key metric for us. Obviously, everybody looks at the ROI as well. Everybody wants to get good ROIs. I always tell people, don't worry so much about the ROIs, worry about the incremental sales that are coming, or the contribution, worry about that that's coming out of your promotion. The idea is not to maximize ROI. The idea is to maximize incremental sales from your promotion activity. So this is, if you will, kind of a high-level function. You might want to think of it a little bit kind of like a regression equation of sorts. And basically, on the left-hand side, we have the dependent variable, which typically, as I said, could be sales or new patient starts. And then the right-hand side consists of all the different promotion activities. And it's not only the promotion activities in the current time period, but it's also promotion activities in, time period T-1, T-2, and so forth. And again, what we're trying to capture, of course, is that, if I'm promoting on a constant basis, January, February, March, and so forth, then the promotion that I do in March is going to also benefit from the fact that I was promoting in February, promoting in January, maybe even promoting last December, and so forth. So that's what we're trying to capture here in the model. And we typically work with monthly data. And wherever possible, we try to tie the promotion activity to a particular doctor or to a particular account, where an account could be a group practice or a practice within a hospital setting. So here are some, if you will, more high-level concepts, but some of them we've touched on, but one or two that I just want to bring out before we get into some of the rest of the presentation. And it's really the so-called baseline and impactable sales. So we have a kind of a primary, we call it a primary model. And we look initially at the overall impact of all of the promotions in aggregate. So we basically dollarize all of the promotions, and we set up a single, or I shouldn't say a single, we set up a primary regression model where we try to estimate what percentage of sales is due to promotion and what percentage of sales is not being driven by promotional activity. We call that the baseline. So what does that mean in business? It means that for an established product, we have customers that are loyal. We have, if you will, an embedded base of customers. We also understand that there are various market activities that can influence sales. For example, we have one brand, and every year in February, they have a price discount. And wouldn't you know, but every year, their highest sales, their highest monthly sales occur in the month of February. So again, there are activities that have nothing to do with promotion, but obviously influence sales, and we want to account for those. Certainly, market competitors, a new competitor coming into the market, a new competitor, or I should say an old competitor leaving the market, those are going to influence sales. Something like COVID, which is something exogenous, is going to influence sales. We have a number of products where in order to get on the product, you have to do some testing. And if you don't do the testing, doctors really shouldn't be putting you on the product because they don't really know if you have a certain condition. And we know that, for example, during COVID shutdown, a lot of these medical tests were being suspended for a couple of months, and we saw that in our sales. And so again, it had nothing to do with the fact that we now have lousy promotions and our sales went down. It had to do with the fact that unfortunately we had the COVID shutdown and patients weren't able to take the preparatory steps that were needed to get on some of our products. So what we find in practice is that mature brands, again, loyal customer bases, 80, 90% of their sales happen without any promotion. On the other hand, launch products, in fact, we have a new product for chronic kidney disease, and I would say probably 3/4 of its sales are driven by promotion. It's a very competitive market. There are a lot of other agents that are out there right now that are being promoted. Some of them are even on television. And so if we did not promote, we would really be left behind from a commercial perspective. So here are the, if you will, key steps in a marketing mix project that I will typically undertake with one of our brand teams. And what I'm going to do is very quickly go through these steps and just highlight the key points here. So we have a kickoff meeting, and it is what the name implies, which is basically we sit down with the brand team and say, okay, what tactics are in play? What are the key business questions? And then we move to a data review step. And this is kind of interesting. We collect the data, and this is an area where Bayer has made a lot of strides. We've cut a lot of duration time off of our projects because we've been able to improve our data integration. So we've done a better job of working with our agencies in terms of getting the data on a regular basis in a formatted way. We've built an enterprise data warehouse which captures the data and which we're able to access as well with SQL code and so forth. And so it's much more seamless. It's not perfect, but it's much better. Now, the purpose of this step, so let me go here. The purpose of this step is really to show the brand team their own data. And in many cases, the brand team isn't always aware of what the agencies are doing. So, for example, I just did one of these data reviews yesterday with one of our brand teams. And I pointed out that there was a spike in television advertising last summer. And the digital marketing director jumped up. I guess she didn't jump up, but she called out and said, oh no, that data is not right. So we went back to the agency and it looks like she is correct. It looks like the agency is going to have to restate the data. So that happens. Once in a while, you get bad data feeds from some of your vendors and that they have to be restated. But again, without the data review step, we would not have had the benefit of her review. Now, in another situation, though, we looked at some social media data. And again, she said, oh, no, that data doesn't look right. Well, we went back and it turns out the data were right. She may just not have been fully aware of all the advertising that was going on or wasn't going on, as far as what the agency was actually doing. So, so part of the data review, obviously, is a data quality step. It's sort of checks and balances because myself and my group, we don't work that closely with the brand team where I would know that there was a problem with last summer's television data. I wouldn't know that. I would just see the data and say, well, if the agency gave it to me, it must be right. So we do need those checks and balances. But I think in other situations, we get some insights. For example, there was one brand where it seemed like in December, their promotion activity just went through the roof. And my conjecture was, somebody had some surplus money left over in their budget and decided to invest heavily in promotion. And it turned out that was correct. But then in other cases, we do get some very interesting insights. So for example, we have some products for contraception, women's healthcare. And we were looking at some data around paid search, and we have certain paid search that is geared towards doctors, professionals, and other paid search that's geared towards consumers, to women who may be seeking information about contraception. And it turns out that the click rates for the DTC, for the direct to consumer advertising, are much higher. And that makes a lot of sense, right? Because the doctors themselves may not see contraception as, quote, an illness. It isn't an illness, of course. But for the women, for the consumers, it's obviously of great importance to them. And so they seek out the information more than the doctors themselves. And again, from a marketing and sales perspective, that's fine. What that means is that the women get the information, they then hopefully take action, see their doctors, and discuss, the contraception, and maybe wind up getting a Bayer product out of it. Once we have all the data, and so like I said, we've cut the time on the data collection. For our larger brands, it's probably a couple of weeks. For our smaller brands, we can probably do it now in about a week or two, which is very good. When I started, there was one project, I think it took me about 5 months to collect all the data. It was pretty hairy. We've come a long way. But then it's time to develop the statistical models. And here are some of the key aspects of the statistical model. We've touched on some of them, so I'm not going to belabor the ones that we've already touched on. We talked about the difference between baseline and impactable sales. Another kind of key concept is this notion of ad stock, which is something that I think is used pretty heavily in consumer packaged goods companies. And conceptually, what ad stock is trying to say is, I alluded to a little bit before, is really the momentum of a promotion, right? So a promotion might start fresh, say in January, and then it continues every month. Well, the promotion activity in February is going to benefit from January. The promotion activity in March is going to benefit from January and February, and so forth and so on. And as you would expect, the benefit curve is a decaying curve, right? In other words, January helps February a good amount, helps March a little bit less, helps April even less. And at a certain point, the January benefit will sort of decay to zero or close to zero. But then the February promotion on top of it is also giving ad stock and giving carryover and momentum. So we capture this ad stock. And again, this momentum factor or this ad stock factor is going to vary by tactic, and it's going to vary by brand. We talked about the decreasing returns to scale of the promotion response. And the way we model that is with a power transformation. You can see the mathematics a little bit below the curve, but basically what it's saying is that we take the promotion level and we raise it to a power less than 1, and that will allow us to model the fact that we have the decreasing returns to scale. We also use something we call, or actually the literature calls, linear mixed effect models. And what that is doing, or what that's trying to capture, is as follows. So what we do is we take our doctors. We generally have most of our models at the doctor level. There's one brand in particular where the data is not at the doctor level, so we have to model at the account, the group practice level. But let's just take the simpler case. So we have these doctors, and we can cluster them into segments. And typically you would cluster them based on their usage of the Bayer product as well as their usage of products in the market. So you might see prescribers that have high, incidence of using products for therapeutic class ABC, medium and low. You might have, say, 3 segments, maybe 4 segments. And then within each segment, we understand that not all doctors are going to be exactly the same. There's going to be some variability within some of the doctors of the same segment. Obviously, they might have different patient pools with different managed care plans, which might make it easier or more difficult for some of their patients to actually get on our products. And that's going to impact their sensitivity to promotion. So again, it's part of the statistical model that we use. This is just kind of I guess, a diagram of how those segments work. And then we have something that we call pathways, and this has been one of the innovations over the last couple of years that I'm kind of pleased about. It has to do with looking at the synergies between tactics, the interactions between tactics. And so, for example, on the digital side, we typically have banner displays as well as paid search. And conceptually, we think of the banner displays as putting a lot of advertising out there with the hope that a little bit of it sticks. So really, the banners are intended for a very wide audience. So for example, we might um, purchase space on certain websites to display banners so that we try to maximize our exposure, say, to oncologists. So, we get a sense of, okay, oncologists look at these websites and we're going to buy banner displays on these websites, and hopefully they'll see our banner displays. We know that not all oncologists are going to be interested in, say, a particular oncology product that we have. But again, we're sort of putting it out there in a very big way. And then what we hope to do is that obviously there'll be some oncologists that are more interested, and they'll start to drill down and maybe do some paid search and click on some paid search to get more information about our products and hopefully lead to a sale. So if we ignored the interaction between banner display and paid search, we would see that the paid search was closer to the point of decision where the doctor chooses the Bayer product. And we would say, oh yeah, paid search, great return on investment, banner ads, so-so. And in fact, that's what we did the first couple of years working with Bayer. That was how our model worked. But more recently, the last couple of years, we're now looking at the synergies. And we're now able to identify the fact that some of the paid search is coming about because a doctor earlier saw a banner display. And so we take some of the contribution that we were earlier giving to the paid search and we put it back on the banners. And we say, look, without the banners having started this customer journey, we never would have wound up with this prescription. And so let's give the credit to the original source of what drove the script, and that would be the banner display. And what's happened, practically speaking, empirically, is that the return on investment for banner displays now looks better. Paid search looks a little bit worse. But if you talk to digital marketing people, they think that the two are very much interlocked. In other words, you would never do a digital marketing campaign without banner displays, and you wouldn't do one without paid search. You would always have a mix of the two. And now by capturing that explicitly in our model, we think we have a better sense of how much sales is being driven by banner and how much by paid search. For the sake of time, I'm going to skip over the example on the personal promotion side, but there are other synergies that we can talk about between promotion tactics. So let me get into some of the optimization work. I think we talked about this before, where we look for kind of the sweet spot where marginal revenue equals marginal cost. And again, we deal a lot with our brand teams. I mentioned one little anecdote right before this call where a woman on one of the oncology brand teams emailed me and said, hey, could you evaluate what would happen if we changed our direct-to-consumer budget for the second half of 2022? What would be the impact on sales? And so hopefully my team can turn that around in the next day or two. That's really not such a big deal. Again, we have scenarios that we can evaluate on the intra-brand level. So in other words, for a particular brand, Can they move money from digital to Salesforce or vice versa or what have you? But then we can also do optimization across brands. And frankly, to me, that's the that's the aspiration here. So I've had some conversations with our CFO. I've had some conversations with our marketing vice presidents. Um, let's put it this way: there's definitely interest, and I've definitely have run quite a few scenarios, kind of proof of concept scenarios and what if scenarios. I can't say to you at this point that it's ingrained in our culture. That's kind of my job, I guess, is to hopefully ingrain it a little bit more into the Bayer culture, so that we start thinking more about portfolio approach to promotions. And I'm still hopeful, haven't given up. Certainly when we do the optimizations within a brand, we have the brand's attention, right? Because that's all win-win, right? We're not taking money from any brand and giving it to another brand. We're basically just telling the brands, look, you can get more incremental sales if you change your mix in how you promote. So they're happy to talk to us. When they start to look at scenarios where, you have to give $1 million from this brand to that brand, when they're winners and losers, it changes the dynamics a little bit. As far as the optimization process is concerned, we assume that we've done promotion response for all of the brands. So in other words, we've done marketing mix, we have all the regression equations, we know all the ROIs, we know all the marginal ROIs for all the tactics. And we also need to try to understand the constraints. Sometimes we call them guardrails, right? Because if you're going to run portfolio optimization or even within brand optimization, you don't want to kill a tactic if it's, let's say it has a lousy ROI and a lousy marginal ROI, you still may not want to kill the tactic. Maybe it was a new tactic, or maybe it's a brand that's just launching, or maybe there was an operational problem with the brand. We've had situations where brands have been unhappy with some of their vendors in terms of how their vendors behaved and so forth. So the point is that you want to put bounds on shifting money, right? So typically we have lower bounds and upper bounds in terms of how we want to move money around. We also have a technical issue that we have to deal with, which is that the regression equations were built around spend levels of a certain neighborhood. And when a brand, for instance, wants to, triple its spend or quadruple its spend, do something, hog wild, yes, we have a promotion response curve, but we really don't have points out there, right? We're really going out a little bit on a limb, right? It's one thing to say I'm going to make a 10% change or a 20% change. If I make a change in the spend level in the neighborhood around which the regression equation was calibrated, that's one thing. But to go far out on a limb, that's potentially a little bit more problematic. Truth be told, we do those kinds of scenarios. We do tell the brands, the implicit or the implied confidence intervals here are pretty wide. So take the results a little bit with a grain of salt, but we will do those kinds of scenarios. So the optimization tool is set up to handle a lot of different constraints. And actually, let me show you the model. It's actually pretty simple. You can see it here. We can put constraints on individual tactics. We can put constraints on individual brands. We also have what we call group constraints. So for example, let's say I get a budget for peer-to-peer programs. And I say, you know what, across all these brands, I'm not going to spend more than $1 million on peer-to-peer programs. We can set up a constraint. Basically, they're all knapsack-like constraints. We can set them up in the optimization tool that we've developed. It's a nonlinear model because, as you can see, the objective function is nonlinear. It has to do with the fact that the response is a decreasing return to scale, right? The sales are not varying linearly with promotion spend. The incremental sales are varying non-linearly. And so that's why it becomes a nonlinear objective function. Truth be told, and Mark Mark and I worked on some airline models, as he put it, a number of years ago. And it's still, by the way, Mark, it is still, if people ask me what was my favorite technical project, that and I'm not just saying it because I'm on the call today, it truly was my favorite technical project was working on airline scheduling. I thought that was the most fascinating problem from a technical perspective, not necessarily from a business perspective, but from a technical perspective. I found that to be the most fascinating problem I've worked on in my life. These problems are much easier. So those problems were, millions of variables and millions of constraints and lots of 0-1 variables and all the rest. These are pretty straightforward. We might have 50 variables and maybe 100 constraints. Our portfolio is not that big. The number of tactics, you might have, say, 10 tactics per brand, 15 tactics per brand. Maybe we have 10 brands. So again, you start to add all the numbers up. It's a relatively small problem by industry standards. What's interesting, though, is that from a Bayer perspective, and maybe even from a pharmaceutical perspective, because I've worked at some other pharma companies, there's not a lot of applications of linear programming or nonlinear programming. And so a little bit, this is considered innovative work. Although, truth be told, when the attorney allowed me to go down to Houston, he said, do you need some references for some of these models? And I said, well, they're kind of out of like an advanced, undergraduate course or something. So he said, okay, I guess you can go. Anyway, we've put everything together in an R Shiny tool. So it's pretty seamless. So we work in R. The statistical marketing mix models are developed in R, and then we identified a nonlinear programming package that works by piecewise linear approximations. And again, nothing very profound, but for pharma, it was like pretty cool. So beforehand, before we found this nonlinear programming package that integrated into R, we were using a greedy heuristic. And obviously we would get feasible solutions, but by using the optimization package, the nonlinear optimization package, we're obviously getting better results. And frankly, it runs much faster. The greedy heuristic tended to bog down a little bit. So that's pretty much all that I have to say. I'm going to get out of full screen mode and let me see if I can get back to the rest of the Zoom. Okay, I think I'm back with everybody, and I'm pretty much on time with the 45 minutes. So certainly, if people have questions or comments, please feel free to either jump in, just jump in with audio or through the chat. I am able to. Actually, I'm not able to see the chat.
There's nobody in the chat yet.
Oh, okay. Okay.
I've got a quick question.
Sure.
Near the beginning, you said that you also do simulations, and
Yes.
I kind of missed that part.
Right. So simulation might have been a little bit of a strong word, and I didn't mean it that way. What I meant was, if a brand, and in fact, so this is what happened this afternoon, a brand came in and said, this is what we think we should be spending on promotion next year. Can you tell us what the incremental sales would be? So we would simulate as if that really was their budget. So basically, we would do the what if analysis. In other words, I'm distinguishing between simulation and optimization. So in optimization, it would be we. In other words, the brand would come to us and say, tell us how we should spend our money for next year. And we would come back and say, okay, you gave us a budget of $1 million and we think, 100K here and 250 there and so forth. With the simulation, we're basically, we're not asked to make recommendations on how much should be spent. We're just basically being given a budget and saying, okay, based on this, what do you expect the incremental sales to be from this? Does that help, Mark?
Yes, yes.
Okay, sure.
On a similar question, just as a really technical one,
Sure.
I haven't used or I haven't heard of copula optimization. Is it guaranteed to find a global optimum?
I don't know. I know it works with piecewise linear. I mean, our nonlinear model is very simple, right? Because we have this concave objective function, and then all of the constraints are knapsack-like constraints. So it's a fairly simple model. I don't think that global versus local optimum would be a consideration here, because I think the feasible region would always be convex.
Um, but the objective function is concave,
Yes.
and if it was convex, you would know for sure that there's a global optimum. But if it's concave, we're not
Hmm.
sure.
Interesting point. All right, that's a fair point. Then I'm going to say I'm not sure. I guess we haven't encountered a situation where we got a result that was very awry. It's a good point. I'll take it back. I'm not sure. Fair point.
So we did get a couple of questions in
Yes.
chat.
Yes. I saw Robin, and hi, Robin. I guess it's been a few years since we've interacted, but glad to be interacting this afternoon with you.
So she asked, is each product considered independently, or are there interactions? For example, hollow effects from one product to another.
Right. That's a very good question. So let's see how to answer that. So we generally work with we treat the brands independently. The halo effects are we've looked at halo effects in one or two cases, and they were not very prominent. So our products tend to be very diverse, meaning we have something for chronic kidney disease, and we have something for women's health care, and generally the patients are different, the doctors are different, the marketplaces are different. So you don't really have the substitution. We had a situation, actually, we have two products for prostate cancer, and one was for non-metastatic and the other one was for metastatic. And we actually looked at for halo effects there, and it was like very minimal. So in general, we do not try to model for halo effects. We just, when we do our marketing mix model, we assume that the promotion is only benefiting the brand that is sponsoring the promotion. And again, frankly, when I see, not that I see a lot of commercials on TV, but I see some commercials on TV, they very rarely mention the manufacturer. So that, and the fact that you can't just substitute these kinds of things, I'm guessing for the most part, there probably aren't a lot of halo effects.
The next question came from Zach. The next set of questions came from Zach Gilstein.
Yes.
He said, relative to what brands typically want to do, how much difference in ROI does optimization yield?
That's a good question. So there was one project that we were working on. It was a brand with a pretty significant budget. It was probably like $50 million. And I would say that Well, actually, let me start this way, Zach. We actually got a challenge from our vice president this year, and she said, "Hey, I've been talking to the CEO, and he thinks we can squeeze more out of our promotions. Um, you know, have a look at it." So basically, we started with kind of a fresh slate, and we said, okay, let's say we were doing the promotion budgets for all the brands. How much more could we squeeze out? And it wasn't that significant. It was like, like 1% or something like. It was a few $1,000,000. Let's put it that way. Which is maybe like 1%. And there are a few ways to interpret that. I guess one way to interpret that is that what our brands are doing. Um, that we've been doing marketing mix with them for a few years, and maybe they've been listening to some of our recommendations over the years, and so what they've been deploying in practice is not that far from optimization. I guess that's one way to look at it. Another way to look at it is that my experience with optimization, even going back to the airline work that we did, Mark, you don't typically find a situation where, oh yeah, if I spent another $1,000,000 on a certain promotion, I'm going to get some windfall of 10 million. That just doesn't happen unless you have a real chaotic situation, which I don't think we have at Bayer. I think we have a pretty professional team with agencies and so forth. And so, the gaps are, smallish. And I remember showing it to the vice president, and quite frankly, she wasn't that blown away, right? So she was hoping to, sort of get rich quick, right? Can we find an area to invest another $1,000,000 so that we can get some $10 million windfall? And that just didn't exist. It was more a question of, hey, if you invest a few $1,000,000 more, you'll see sort of like a 1% increase in incremental sales or something like that.
Thank you. Zach asked a couple more questions, but I'm going to jump to Ariel Rodriguez. He said, hello, Moshe. Great presentation. Thank you. A question about the methodology. Are regression models built from experiments, that is, test versus control groups, or are they based on observational data? I'm curious about your view on the potential and use of causal analysis and techniques.
It's not based on test and control. It's based on observational data, and implicitly there is a notion of test and control in there, right? Because within our population of doctors, there are going to be some doctors, for example, that were exposed to promotions, 1, 2, and 3, and then another group that only was exposed to promotions 1 and 2. And so the regression model implicitly is doing that sort of test and control, but we don't explicitly have a control group, like sort of a holdout where we don't promote to a certain group of doctors, or we explicitly say, hey, these doctors are not going to get samples, or these doctors are not going to be exposed to digital marketing. We don't have that. Now, you asked about my point of view on causal. Could you repeat the last part again, Mark? I'm sorry, I missed that a little. I'm not sure I have a point of view, by the way, but I certainly want to give Ariel the question.
I'm curious about your point. I'm curious about your view on the potential and use of causal analysis and techniques.
To be honest with you, Mark, I'm not sure I fully understand the question, or maybe I just don't have a point of view. To be very frank, my background is primarily on the optimization side. Obviously, I've worked with statistical models, but I'm not sure I fully have a point of view to answer your question properly, Ariel.
Ariel, you can talk. Ask to unmute.
There you go. Thank you, Mark, and thank you, Moshe. I think what I was aiming at is, um, given that it's based on observational data, how to make sure that you're comparing apples to apples, right? Like that you're controlling for the differences in the treatment groups, right? So that there is no confounding factor that is driving the effect rather than the treatments themselves. Just wondering if your team thinks about that and how they take that into account.
Um, hmm. Wow, that's, I guess what I would say is that we collect the promotion data, meaning that, we build a database, basically a customer database. So for each doctor, and for each month in the horizon, we basically indicate if that doctor was exposed to a particular promotion, and in some cases, sort of the level of promotion. And that becomes our input for the right-hand side of the regression analysis. And then we also have the corresponding sales for each of those months. So we basically put all of that data into into a model, and that's how we develop this. Now, the truth of the matter is we have a whole series of regression models, right? So we start with this primary model where we aggregate all the promotions, to sort of differentiate between baseline and impactable sales. And then even within impactable sales, we'll typically work with some buckets. So we might work with direct to consumer advertising, we might work with professional advertising, we might work with Salesforce. So we'll then have, kind of a hierarchy of models. So in other words, the first model will tell us at somewhat of a high level, is the Salesforce driving sales? Is it the digital marketing and so forth? And then we continue to scale it down so that we look at individual tactics. So, for example, if it's digital marketing, so was it social media? Was it banner displays? Was it videos and so forth? So those are the steps. I'm not sure I'm addressing your question explicitly. I think it's a very good question, but that's what we do.
I'm going to get one more question in.
Sure.
It's from David Hunt. You mentioned that you consider competitors. If you know a competitor is planning to outspend Bayer for marketing for a product by a factor of 2, would that impact your model and your planned spend for promotions?
Right. So the truth of the matter is we consider competitors, but not explicitly. Right. So what's missing, and it's always going to be missing, we cannot get the spend levels for our competitors. Right. Our competitors are not going to reveal their advertising budgets to us. So we don't know what our competitors are doing. When I mentioned competitors, I mentioned it more in an aggregate sense that, for example, if a competitor, for example, received a new indication. So, for example, if there's an oncology product and the FDA just approved this oncology product for a new tumor type, and Bayer already has a product for that tumor type, that's liable to take some market share. So one thing that I didn't talk about, which I probably should have, and maybe it addresses Ariel's question a little bit as well, in addition to having the variables for promotion activity, we also have a series of indicator or index variables, 0-1 variables. And these are intended to account for sort of one-time events. So I mentioned that price, that pricing activity that took place every February from one product. We would actually use an indicator variable, an index variable, to signify that, hey, wait a minute, you've got to treat February a little bit differently for this brand because of this price discount program going on. So, for example, if the FDA in June were to approve a new line indication for one of our competitors, we would probably use an index variable to model that, and that would go into the baseline, right? Because that would either cause us to lose some of our baseline sales, or if a competitor was withdrawing, it would cause us to gain sales. But again, it would be having nothing to do with our promotion activity. It would have to do with this exogenous market event. So that's how we capture it. We just simply don't have data on competitors, and I don't expect we ever will.
Well, thank you, Moshe. This was a great talk. I really appreciate you speaking at the Philadelphia Informs chapter. I wish everybody a good evening, and thank you again.
Thank you very much, Mark, for inviting me, and thanks for the good discussion. It was very engaging. So it's nice to get the questions, frankly, because it's nice to have the engagement. So thank you, everybody.
You're welcome. Bye-bye.
Have a good day, everybody.